Hello, everyone, and welcome to this webinar. My name is Ryan Colasso. I'm a physician from India. I'm a doctor who graduated from India, but also for the past 3 years, I have been working as a physician editor with AMBOSS. Today, I'm here to take you through the AMBOSS platform and show you what we have created. Some of you may have already used AMBOSS, may have heard of it, but for those of you who don't know about it, AMBOSS is, well, a medical study tool with which you can study all the subjects starting from preclinical all the way to clinical. So it covers the day you enter med school all the way till the day you graduate. You could use AMBOSS on your computer, on your phone, on as an app, and it could possibly be the only resource you need to go through the whole of med school, which is a dream, right? Considering the number of books that we have to purchase. Well, today I'm going to show you through AMBOSS. Let's see what we are going to cover in the webinar today. First of all, I will take you through all the different parts of AMBOSS, the library, the question bank, all the personalized analysis tools that we have built in. After that, we'll speak a little bit about why you could trust AMBOSS. And then we'll talk about how AMBOSS could be helpful in these international exams like the IFORM or the USMLE. And at the end, we'll conclude with a little surprise for you. But first, I have a few questions for you. Or rather, I would answer a few questions that you may have. First of all, why are you all here today? Well, your Medical Students Association, which is the Kazakhstan Medical Students Association, approached us and said that they would like to get into a partnership with us, which we were happy to do. And what we've noticed is that they are extremely keen to provide all Kazakh students with the best study tools that they possibly could. And obviously, they heard about AMBOSS and realized that this could be helpful. They've tried it out and they think that all of you could really benefit from it. So we decided, all right, let's provide a trial to all the Kazakh students. Now, the thing is, we are here today to go through AMBOSS so that I could show you all the little tips and tricks and all the little corners of AMBOSS so you can understand it. Because you need to know how to use it if you're going to try it, right? A professor of mine used to always say that the best stethoscope that a medical student could have is the one that lies between the two earpieces of his stethoscope, which means that you can have the best tool, the most expensive tool ever, but unless you know how to use it, there is no use of how good that tool is. So even if you're going to use AMBOSS, you need to know how to use it. And today we are going to show you this. The other question would be how it benefits you, right? And for that, what I have to say is that all of us, we go through an exam and we come out and we have felt that we could have done a little bit better, right? There's always that little bit of a difference that we could have done and gone from the potential highest marks we could get to the actual marks that we get. What AMBOSS will try to do is to decrease this little gap, all right? And we'll show you how how this is going to happen. And the next thing is, who says that I need further help? Well, there is, in my 8 years in medicine and 3 years as a medical educator, I have never seen a medical student say that this is it. This is the best I can do, and I could not possibly do better. We always want a little bit more help to do better. That little 2-3 marks which make the difference between the distinction and the first class. So this is what AMBOSS is going to help you out with. All right. There's a little quote that I would like to tell you that we all know exams don't make good physicians. Your clinical acumen does not depend on your exam scores. However, it is something that we all have to do. We all have to go through to become one. So it makes sense to be absolutely prepared for one, right? All right. So first thing first, let's not waste any more time and dive right into AMBOSS. All right then. What happens when you log into AMBOSS is you see this, the AMBOSS dashboard. Okay. Um, there are three main parts to AMBOSS. There is the knowledge library. Now, this is like a normal library which contains all your knowledge, all your medical information of the basic sciences, the clinical sciences. In fact, it also has clinical skills where you can go and learn how to do clinical skills and other parts of your medical. There is the question bank, which covers all the question banks related to every subject that is mentioned in the library, every topic that is mentioned in the library. And then there's the analysis, which gives you your analysis of how you are doing. The library is divided, of course, according to subjects. And I could go into each subject and find what it is that I want to look for, each system, and then find what, or I could simply emboss it and look for the topic that I want to read. For today, to demonstrate, I have chosen a topic which most people would kind of understand. It's an easy topic, but most people kind of know what it could mean. So I'm going for acute pancreatitis. Um, all right. So what I did was I put in acute pancreatitis in here, and what popped up were all my options, right? And then when I see over here, there is this quick definition. If I want to know what acute pancreatitis is, I can just quickly look at the definition and move on. But if I want to study it in detail, I could go to the top suggested card or the chapter, and you will see that it's quite a big chapter, which covers, if you see on the left, it covers every single aspect of acute pancreatitis as a topic. Now, the main guiding principle of AMBOSS is the fact that we want to integrate everything into one place. All right. A lot of times, your physicians, your seniors would tell you something that a patient does not come from chapter 16 of so and so textbook. A patient comes with all of these multiple concepts from anatomy, physiology, biochem, pharmac, all mixed together. And you, as a doctor, need to be able to interlink all these multiple subjects and chapters that you've read together and apply that knowledge to the patient. Well, that's what we've tried to do in AMBOSS. We've kept everything combined. So when you read acute pancreatitis, you don't just read how it looks like and how to treat it, but also everything about it. But all that said, you will notice everything in AMBOSS is in point form, so you don't waste time, and it is not very heavy to read. All right. So say I start reading acute pancreatitis and I want just a quick summary. I'm going to class. I just want to know what it is. I could just read the little abstract over here, which gives you a basic idea about how the feature, how it is caused, how it looks in the clinic, how you could treat it. And if I have even lesser time, if I maybe don't want to study, I could click on this little video here. And you may have heard of osmosis. Well, every single AMBOSS chapter is linked with the relevant osmosis video. So if you have just 2 minutes, you can just look at the osmosis video and you'll get a great idea of what it is. Another cool thing that we've tried to do is, say I'm reading this chapter, okay? And this happens very often. I'm reading this chapter and I don't understand, let's say I'm reading this sentence over here, and I do not understand what it is that pancreatic enzymes refers to. I don't know what it means. All I have to do is hover over it and it gives me a whole definition of what it is. I'm not wasting time trying to look it up elsewhere, Google it, Wikipedia it, get distracted. Everything I need is right here. And we've done this for every single thing. Now, every single term, whether it is simple or complex. Like in this case, enteral feeding is quite a complex topic. And if I don't understand what it means, it does not give me any idea as to what the rest of the sentence is. So this helps me quickly get an idea of something that I may leave otherwise if I was reading from a textbook. Of course, if I want to read more about it, I can click on it and it will take me to the whole specialized chapter on enteral feeding. Well, going further, if you will notice that etiology has also anatomy diagrams, and every chapter, every topic is covered with anatomy, pathophysiology, everything integrated together, as I had said. And now this is a nice diagram. We make these in-house with our illustrators and physician team combined. And if I want to know more about it, of course, there is the description. This is very standard, like a textbook. But what is extremely cool is if I want to test myself, I can take off the labels and I can test myself. And if that is not enough, I could even start a quiz where it tests me in an interactive manner what it is that I'm doing. Now, this gives me the basics of the subject. You will notice there are also uh, these little call out boxes, which, as I said, everything is given point wise in AMBOSS, but sometimes you need a little more information, right? So, if you need a little bit of an explanation of what it is, it explains, it gives the rationale behind it. What this translates to is that when you're reading it, when you're reading from AMBOSS, you're not faced with a wall of text. But that does not mean that you are compromising on knowledge. It gives you all the rationale of why trauma could be a cause for pancreatitis. We also have these little funny mnemonics, as you can see. So AMBOSS is created by 80 physicians from all over the world. We use all the knowledge and our experience from our time as medical students to try and make your life easy, right? And the best people to learn it from are the people who've gone through the same grind that you are going through. So we use like our own little mnemonics to give you mnemonics to remember this easy, to score higher in your exams. Another thing that I wanted to show you, as you can see, there's a lot of features. If there is clinical features, you will see that we put all the clinical features also with supporting multimedia, so you don't forget what you are reading about, because there is that visual correlation. And with the diagnostics and everything is mentioned in easy forms to remember, but also there are these little exclamation points, which means these are information that are very valuable for you to remember for clinical practice. Another extremely, and one of my favorite parts of AMBOSS that I wanted to show you was radiology. Now, radiology has always been tough for medical students, right? It was tough for me when I was in med school. Every time someone showed me a CT scan or a chest x-ray, it just looked like a sea of black, white, and gray. And then your teacher would be telling you, hey, look over here, this is where you're supposed to look, or this is what the feature is. But unless they point it out to you, you don't know where it is. Now, the thing is, we are not always sitting with a teacher or a senior. If I'm studying at 2 o'clock in the hostel, I don't know if I'm going to be told where to look. So what we've done in AMBOSS is we are that little arm around your shoulder to guide you. Every little radiology image we have has this overlay button. And when you click on the button, you will see that it highlights where you're supposed to look. And this is built into every radiology image that you have. This is extremely important because this is how radiologists are trained. The more and more you see CT scans, the more and more you see chest x-rays on AMBOSS, and you see these features pointed out to you, the more you'll realize that in the future, over time, you don't really need these overlays to pop. Your eyes will automatically start recognizing patterns and pathologies in radiology. Even our treatment gives you these little important things to remember. And there is, as you can see, a lot of information. Now, the thing is, you would ask, where is this information from? You know that your exams are important to you, medical studies are important to you, and there is a lot riding on it. So you can't just trust any random resource. With AMBOSS, what we do is we create this information from the most standardized resources, the latest research papers, and a very, very thorough literature review. So this little card that you saw of acute pancreatitis, you will realize that at the bottom of it, there is a whole list of references. And if you go through the references, you'll see they are very standardized references that has been used to create this card. So in case you wanted to study further, you could also directly go to the source from where this information is. You could verify that it is all good, very solid information. Now, once I have read through acute pancreatitis, I could mark the chapter that I have learned it. I could even mark it as a favorite. Now, once that is done, what I can do is look, all the information that you read is one bit of it, right? But you need to also be able to test yourself. You need to see the information in action on patients. The problem is, it is not every day that what you read turns up in the hospital. So if I've read acute pancreatitis, does that mean that there will be a patient that I can examine? Probably not. However, if you start a question bank session in AMBOSS, what it will do is it will open up, in this case, 18 questions. Each of these questions is a case that tests different concepts that were taught to you in the acute pancreatitis chapter. This is extremely, extremely important because you don't now just remember information, but you also have to apply it, which will make sure that you remember it for a longer term. Another thing is that not all the answers over here in this session are going to be related to acute pancreatitis. These are cases which look like acute pancreatitis, but may not necessarily be. Because a good doctor does not just know when to make a diagnosis, they also need to know when a certain case is not a certain case, right? So this is testing your whole concept of differential of the topic that you've just read. Now, the important thing over here to remember is, so this is a question, this is exactly how a patient will present to you in the hospital. So there is the presenting history, there is a lot of past history, there is also her personal history, her lab reports, and some radiology reports. This is exactly the amount of information you get when you are seeing a patient. Now, this can be a lot, right? And if you were seeing this patient in the hospital in the OPD and there was a senior resident sitting next to you, they wouldn't just tell you, okay, this is the case and treat it this way, right? If you think to the best teachers that you have encountered in med school, what they try to do is they believe that you know the answer and they give you a hint to push you to the answer and get the answer out of you. They don't just give you the answer and move on, because they want you to think. And this is what AMBOSS does. Now, say I don't know what this question is all about. What I could do is I could put on this highlight tool. And what it does is, through all of this information, it highlights the most important parts. And then you can just concentrate on that information, disregard the others, and see if you still can solve the question. In case you still don't get what the answer is, you could still ask for another hint, which is the attending tip. And this is like a senior sitting next to you and giving you a little more push towards the right answer. And at this point, maybe I'm ready to take a guess. And I take a guess. Now you will notice that I got it wrong. I got it wrong, but I was not told what the right answer is. This is very important. What we are trying to do in AMBOSS is to teach you how to start thinking. It is not about how many answers you get correct on AMBOSS, but after doing a lot of AMBOSS questions, if you have gotten the concept right, what matters is that it will improve the number of answers you get right in your exam. So with the wrong option, you will notice that we still have the same features, of course, where all these definitions pop up. And if I read the explanation, what it tells me is not that you are wrong, please try something else, but it tells me exactly that, of course, this patient could have been pancreatic cancer because of certain features. I'm just going to read this out and you can understand it. While this patient can present with epigastric pain and malaise, which this patient has, it could have been pancreatic cancer. But because of the presence of fever and leukocytosis, it is less likely. So it is making you compare and contrast two important concepts. Now, the next time you get a case which has the same symptoms but does not have these contrasting features, next time you get a case of pancreatic cancer, you can already recognize it. And that is extremely, extremely important, because what it means is with every question, you are learning not just the correct answer, but one, two, three, four, five linked concepts. So if in this case, with 18 questions, you are most likely to learn about 200 different concepts, right? Although you just set out to learn one, which saves you so much time. Now, say I got this answer right. In this case, it is pancreatic abscess. It again, as I said, all our radiology has overlays, captions, which helps you understand it better. And the other cool thing is now, after reading this explanation, which explains to me why it is pancreatic abscess, if I want to read in detail why it is this, if this much is not enough, I click on this little button over here and it opens the whole chapter next to me. And not just the chapter, it also highlights exactly the parts which are relevant to this question. This saves you so much time going and looking for stuff, right? And you don't have to go around finding the textbook, finding the notes where you made, and you'll find it right there. Now, this is true for every single question that we have. Let's say that I have finished all my questions and I go to the end of my session. What it will give me is a whole analysis of how I did in this question session. But what I wanted to show you, and this is extremely cool, is this analysis. Like, if you go to the analysis feature and you want to know what it is that you need to study, AMBOSS will give you a whole list of learning cards that you need to study. And how this list is created, and this is where the strength of AMBOSS lies, how this list is created is based on the on the things that you got right or wrong, which means that if you got an answer wrong on a concept that is tested, AMBOSS logs it as your weakness. And if you get it right, it logs it as your strength. Based on these weaknesses and strengths, AMBOSS will tell you exactly what it is that you need to study. And this, in general, is super, super helpful, because you are not just studying or wasting time reading things that you already know. Again, on the concept of wasting time and not wasting time, I'm going to go back to the chapter of acute pancreatitis. You remember this chapter, right? Now, if you go to this chapter, I've done the questions, I've read everything, I've solved a lot of questions, and now I want to revise it. I could revise it by changing it to high yield, which will shorten the chapter to the most important bits, or I could even put on something called the learning radar. And when I put on the learning radar, what happens is there will be parts of the chapters which turn red. And anything that I got wrong, those parts of the chapter will turn red, and I could go back to it and it is highlighted for me what I got right or wrong. So this is, in short, pretty much what AMBOSS is and how it could help you, right? Now, as you can see, there is a lot to be helped out with. There is a lot for you to handle. And what is extremely important for you to understand is that all these features can only make your studying much, much more powerful without wasting time. But what is most important is how it helps you in your competitive exams, correct? Now, the thing is, in general, all the students around the world who use AMBOSS tend to score higher than the exams. But we have done two specific case studies, and those are for the USMLE and the IFORM exams, because all of AMBOSS's material is optimized according to the guidelines of the NBME, which composes these exams, all right? And thousands of international medical graduates have scored higher than the exam. The fact is that over the past 3 years, exam takers that have used AMBOSS, for example, for step 2 CK, have always scored 15 points higher than the rest. But you shouldn't believe me. There are these links over here, and you can immediately go to the links and check them out for yourself. And you will see that this is proven by study. Another thing is that AMBOSS is created by a team of 80 doctors from all over the world who have gone through the same grind like you. And what we want to do is make medical studies easier for you than it was for us. The other question arises as why should one trust AMBOSS? And the only answer I have to say is that look, everything you saw is impressive, right? But you still don't have reason to trust me. I would say don't trust me. Don't trust any physician, anyone who's sitting on a screen somewhere else in the world. You have the opportunity to try it out for yourself, test it out, and see. You know that all the resources are mentioned over there. You can check it out. You can see that it is all standard resources. And you can look at our track record. I've shown you where you can go and take a look at the studies that compared AMBOSS results with other results. But what I wanted to say is, if you want to try it out for yourself, what is going to happen is your Medical Students Association, Kazakhstan MSA, has gotten in touch with us and they have arranged a trial for you, which means that all members of Kazakhstan Medical Students Association will get 15 days to try AMBOSS for free. Try it out, check it out, and see if everything that I said checks out for you, whether it does well. Try it out for maybe a class test or a case that you're going to see. And I'm sure you will find that it makes us see a world of a difference to how you were studying, how well you study. Now, there will be a trial code which will be shared with you. Everyone who registered for this webinar will receive the trial code in their email, but also Kaz MSA will send it to you by email anyway. And you can use the trial code. There will be instructions and you can try it all out by yourself. And you will see that hopefully AMBOSS really makes your life much, much easier. All right. I hope this was helpful to you. I'm going to start taking a few questions that turned up. I can see that there was just one very important question, which is it USMLE questions? What I would say is that yes, the questions are extremely, extremely helpful for USMLE. If you are studying for the USMLE, if you just use AMBOSS, I can assure you, you will cover everything that is tested in the USMLE. However, our questions are built also keeping an international perspective in mind. So it's not that by studying for AMBOSS, you're only preparing for the USMLE. It can cover pretty much every medical course around the world. The only difference could be maybe in the units or maybe in the emphasis. So if there is a certain disease which is endemic in your region, maybe it is not covered in as much detail in AMBOSS as it would be covered in your country's medical curriculum. But other than that, if you are asking for the USMLE or for the IFORM exams, I think you do not need any other resource other than AMBOSS. And I'm not saying this as an AMBOSS employee. I'm saying this as a doctor, as an educator. I can assure you that it is going to be extremely helpful. Will it help in step 1? Yes. AMBOSS covers all your step 1, step 2 CK and CS as well. In fact, also bits of step 3. And the thing is, when you buy AMBOSS, you get access not just to one step, you get access to every single part of the platform because we want you to connect everything, right? So yes, it is helpful in step 1. AMBOSS users tend to score around 11 points higher than the national average for the step 1 in the US. So yes, step 1, step 2 CK, step 2 CS, in general, any subject. There is one more, we have time for one more question, and then If you have any further questions, please write into fmi@amboss.com, fmi, or info@amboss.com, and we will get back to you. All right. Uh, okay, I'm taking my last question for the day. The last question is, what about iForm? So AMBOSS, as I said, is extremely optimized towards the iForm and the USMLE. Uh, I don't know if you guys know this, but basically, the National Board of Medical Examiners, the same board that holds the USMLE, also holds the iForm. And all of the content that is on AMBOSS is very strictly according to those guidelines, right? So basically, if you read from AMBOSS and if you do questions from AMBOSS, there is a very high chance that you will recognize that question in your exam as well. Thousands of students have used AMBOSS for their iForm in Ukraine, in Qatar, in Lebanon, in Oman, and they have done really well. You can check out our success pages and you will see that it is absolutely for iForm, and you can be assured that it will, if you are reading with it, you will do well in your exam. It could be the iForm or the USMLE. All right. I think that is all the time we have. I hope this had been extremely helpful to you. You know that you will get your trial code. Watch out for it in your email inboxes. And I hope that you use it. Please use it extensively. It's for free. You don't waste time if you, you don't waste money if you're trying it out. Try it out for the 15 days. Check it against your exams. And I hope that you love it. And that's that. Have a great evening, and thank you for tuning in. Good evening.